Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department, giving our weekly update on the coronavirus pandemic. Obviously, there's been a lot of news over the last couple of days dealing with the vaccines. The good news, setting that aside for just a minute, is we continue in Allegheny County to get an awful lot of shots in arms as people now, everybody's now eligible to sign up and get vaccinated, and so many of our friends and neighbors are taking advantage of that. We have over 800,000 shots in arms at this point. Close to 70% of the over 65 population has had at least one shot. Most of them have had full vaccination. So this is obviously our key to getting back to normal and normal freedoms and et cetera when we protect ourselves and our neighbors by getting the vaccinations. We also have a lot of partners. I'm going to thank them at the end, but there were a lot of partners throughout this region who have just been very helpful. They've been helpful throughout, but even more recently with the vaccine sites and help and getting shots in arms to all of our friends and neighbors. So we'll talk about that in just a minute. But now let me turn it over to Dr. Bogan to give her weekly report on the pandemic. Dr. Bogan?
Thank you, County Executive. Good afternoon. Thank you for joining us again today. It has certainly been an eventful week, and while I wish the news was all or even mostly good, it's simply not. The fourth wave of cases continues in Allegheny County. Day after day, we see totals of at least several hundred people testing positive. The number of cases with the variant strains also continues to increase. The Allegheny County positivity rate for PCR tests continues to climb, and according to the state dashboard, it is now 9.6%. That's a percentage increase from last week. Similarly, hospitalizations continue to increase, and sadly, we continue to have COVID-related deaths. And we've had a total of 79 deaths from March 7th through April 10th. If you joined us last week for our briefing, you'll recall that the discouraging news of a fourth wave was somewhat tempered by the positive news of our ongoing successful vaccination efforts throughout the county. And that good news continues today. Over half of the adult population of Allegheny County is at least partially vaccinated. And more than 78% of people most at risk for severe COVID outcomes, that is those 65 and older, have received at least one vaccine. And these numbers continue to rise thanks to ongoing efforts by local healthcare providers, pharmacies, federally qualified health centers, doctors' offices, and the health department. The data on breakthrough cases is also very encouraging. Breakthrough cases are people who have a positive COVID test 14 or more days after their final vaccine dose. As of April 13th, we are aware of about 109 breakthrough cases among the approximately 213,000 county residents who were fully vaccinated by the end of March. So that's about 0.05% of those vaccinated, which is truly remarkable. To continue the effort to vaccinate as many people as possible, as fast as possible, Governor Wolf announced a week ahead of schedule that starting this week, all people in Pennsylvania age 16 and older are eligible to receive the vaccine. Despite the progress made on the vaccination front, we also experienced a step back yesterday when federal and state health officials called for a pause in administering the Janssen, also called Johnson & Johnson vaccine. Although Allegheny County Health Department had not yet distributed the vaccine at any of our clinics, we are aware that there are many vaccine providers in our county who have. The federal recommendation on pausing the use of the Janssen vaccine came after a very small number of women, 6, developed rare blood clots. These 6 cases presented out of 6.8 million people who have received the Janssen vaccine in the US. To my knowledge, no one who was vaccinated locally has suffered any serious health complications related to the Janssen vaccine. As your health department director, I urge you not to view this pause as a signal that our local, state, or federal vaccination efforts are in any way flawed. Rather, view this response as an evidence that the healthcare officials will do and have done decisive action at even the slightest hint of an issue, and we will continue to do so. To anyone who has already received the Janssen vaccine, be aware that adverse reactions are extremely rare. The 6 known cases of blood clots took place within 3 weeks of getting the vaccine. So if you develop severe headache, abdominal pain, leg pain, or shortness of breath, please contact your healthcare provider and seek immediate medical attention. Meanwhile, I continue to urge everyone to get vaccinated. So until the Janssen vaccine is given the green light to continue, please sign up for either a Moderna or Pfizer vaccine. I'm concerned about vaccine hesitancy. The fewer people who get vaccinated, the longer this virus will linger in our lives. And the best way to defeat this virus is to continue the vaccine rollout as fast as possible. And there are plenty of appointments available, both at our clinics and other clinics across the region. If you have any concerns or questions about the vaccine and our distribution efforts, I encourage you to go to the Allegheny County website and click on COVID-19 resources link at the top of the page. There you'll find answers to many of your questions, plus information on our current vaccination clinics in Castle Shannon, the Hill District, Oakland, McKeesport, and Ross Township. So in a moment, I'll end my remarks before moving on to questions. But first, I must give everyone watching this my weekly reminders. I can't stress this enough. It's vitally important to follow our basic mitigation plan. Keep physically distant, wear a mask, and wash your hands. I repeat this week after week because we know that these measures are effective. Also remind people who decide to return to bars and restaurants that safety guidelines are in place not only for staff and owners protection, but for patrons as well. So protect those around you and serving you by following the guidelines. And lastly, a final reminder to take a moment to please register for your vaccine if you haven't already done so. So thank you for your time. Be safe and be kind.
Our first question is from the Post-Gazette. Has there been a decrease in demand for COVID-19 tests? If so, are you concerned that the number of cases may actually be higher than what's being reported?
So there are likely more cases around at all times than we actually test for, because many people who get COVID-19 have no symptoms. So remind you, if you have symptoms, please go get tested, or if you're a close contact of someone, to get tested. When we look at our test data, we continue to test about 32,000 tests a week for the past few weeks, and that actually is an increase from about mid-February, when we had about 30,000 tests a week. So we've not actually seen a decrease.
This next question is from the Observer reporter. Is there an increase in younger people getting the virus? And if so, how sick are they getting?
So the proportion of cases among those ages 5 to 24 has steadily increased since mid-March. But hospitalizations among this group have not really increased at all. And I just want to remind people that we put out a daily COVID update, and those data about the proportion of cases by age are provided every day in that update.
This next question is from WTAE. With distribution of the Johnson & Johnson vaccine on pause, is Allegheny County confident that there is enough supply of Pfizer and Moderna to vaccinate any eligible adult who wants to be vaccinated?
Yes, I believe there is. There are appointments available both at the county, through the health department, and through lots of vaccine providers, which makes me think that there's plenty of vaccine available, so please sign up for your appointments.
I believe you touched on this in your remarks, but from WESA, it seems increasingly that vaccine providers are hitting a point where instead of being inundated with people wanting vaccinations, providers have more doses than patients. What might this indicate about vaccine hesitancy?
So I think, again, we're still filling a lot of appointments, and there's still a lot of people getting vaccinations. And so there are still people who want them. But there probably is some hesitancy as well. And I think we're all aware that right now we've been running mass vaccination centers and clinics, not us, but lots of people. And I think over the next couple of weeks, as we get more and more people vaccinated, we have to shift our focus from these mass vaccination centers to really boots on the ground in neighborhoods, in communities, in churches, in community centers, really to reach people who may be a little hesitant, just need something more local in a trusted location, so that we can reach more and more people out there who want vaccines but maybe aren't willing to go to sort of a mass vaccination site.
This next question is from the Tribune Review and is also related to Johnson & Johnson. Will the pause in administration affect the health department strategy for the next couple of weeks, and if so, how? And related, how many doses of the single-dose vaccine had the health department planned to receive in the next few weeks?
So it really won't change what we're doing. We have been giving the Moderna and Pfizer vaccines and will continue to do so. And we have scheduled out a number of weeks of appointments. The doses that were coming to the health department were, for Johnson & Johnson, were really considered regional doses as part of an effort through the Pennsylvania Emergency Management Group and us. The plan was roughly about 12,000 doses a week. But that number could change and was always up to some fluctuation.
This next question is from the Post-Gazette. There continue to be deaths of people in their 60s and older in the county. Has the county tried to track how many of them have not been vaccinated? If so, what can you tell us about people who have died from COVID-19 but have not been vaccinated even though they were eligible to be vaccinated?
So our data shows that people who are vaccinated really are not dying of COVID-19. It is a really effective vaccine. We are aware of only one case that may be COVID-related who had been vaccinated, but again, that person was elderly and in long-term care. So again, not entirely sure, and the details are not available. So again, the vaccine is highly effective. They were highly effective in the clinical trials. The data has been borne out in what we've seen in our community, that those that are vaccinated are not dying of COVID-19. So again, I'm going to say again, please sign up for your appointment.
This next question is from WTAE. This morning's update detailed 939 test results from GS lab tests, dating as far back as January, but which had not been reported to the state until yesterday. Can you explain that a little bit further and tell us why that is?
Sure. So this laboratory started to perform testing in the middle of January, really antigen testing and some antibody testing. And when you come online as a new laboratory, you need to have a system that uploads your results into the Pennsylvania NED system. And it took longer than expected for the laboratory to make that connection work. And that was the delay in getting them uploaded. And once their connection was fixed and ready, they uploaded all their back results, which is what the large amount of data was back from January, February, and March.
This next question is from the Post-Gazette. Many schools in the area have released plans to hold prom. Does the health department have plans to release any specific guidelines on how districts should go about that?
So there are strategies, of course, to reduce the spread of the virus at proms, just like there are everywhere else. First and foremost, properly worn masks that are tight-fitted should be enforced, because mask wearing really does prevent the spread of the virus. If possible, events can be held outdoors or windows open to keep ventilation good. That's really an important area as well. People can hold separate events for juniors and seniors to keep the sizes small. Those in attendance could also get tested a couple of days before. We have lots of availability of testing in our community, and so that would be another strategy that schools may want to take. But each school really should review their own events against the CDC guidance and that put out by other organizations, and adapt their plan to their specific event, the size of the event, and where it's being held.
This next question is from WESA. Can you give us an update on the McKeesport Clinic?
Sure, the McKeesport Clinic has been going great. We've been vaccinating about 80 people there a day. And we haven't really had any issues filling up those appointments, which is great. And Reverend Coleman and her team have been wonderful partners, so thank you again for that.
And this final question is from the Tribune Review. The clinic at Pittsburgh Mills, which was a partnership with the health department and the health systems, opened for walk-in appointments today. With all adults now eligible in Pennsylvania, can we expect to see more of walk-in appointments or walk-in scheduling, including at county-run clinics?
Again, I think I talked a little bit ago about sort of pivoting from these large events to sort of smaller events, more availability, and I think part of that pivot will include more availability for walk-in. Right now, lots of places are not doing walk-up, but some are, and again, I expect with time that we'll transition to more walk-up availability.
And that was the final question, if there's any closing remarks.
Thank you, Dr. Bogan, and for keeping us informed on cases as well as vaccinations and all the events that continue to occur. As I mentioned, as Dr. Bogan mentioned, now over 50% of the adult population in Allegheny County has had at least one injection. That's quite a milestone, and we know we got more to go. As we get more and more people vaccinated, the closer we come to getting rid of this virus from our community. And the other milestone, the Allegheny County Health Department has also injected over 100,000 doses of those 800-some thousand and put those in arms. And those clinics and those partnerships come with just a lot of great folks who are out there cooperating with the community, with the health department, and I want to acknowledge some of those. The sites that we've been using in Monroeville, both at the DoubleTree Hotel and at the Convention Center, our friends at the Castle Shannon Volunteer Fire Department, Banquet Hall, Ross Township Municipal Community Center, which are still occurring there, Central Baptist Church, Bethlehem Baptist Church, you acknowledged earlier out of McKeesport, the Peterson Event Center, and then obviously multiple sites that we've been going to, the County Health Department in the city, the county, and McKeesport housing authorities, and the various groups that have been helping with that. Monroeville, Castle Shannon, and the Ross Township Police Departments, thank you. The Medical Rescue Team at the South Authority, the American Red Cross, the Ross Westview EMS and McKeesport Area Rescue Squad, Pitt and Duquesne science staff and students, the Medical Reserve volunteers, and then the various departments in the county. Obviously the Health Department, our Emergency Services Department, Human Services, Information Technology, and our county police. So as Dr. Bogan said, the best way right now is for folks to get vaccinated, get your family members vaccinated, get them signed up right now. It's now, everybody is eligible. And, you know, I think, you know, what Dr. Bogan said earlier on, even with the J&J issue, we have 6 people who've had a result with over 7 million doses. That shows the care and the quite frankly, the caution that they've taken to make sure that people are getting vaccinated and are being safe. The best chance to become healthy, to become free, and to prevent fatalities and acute hospitalizations is to get this vaccine. So let's get everybody vaccinated. We're going to continue to do our things, working together with all of our partners and making sure that, you know, whether it's Moderna, whether it's Pfizer, whether it's J&J, whatever vaccines that are going to be coming available, we want to get them into people's arms so that they can be safe and get back to the normalcy that we'd all like to see. So we will be talking to you again next week. Stay tuned for any